This is Dr. Michael Allon. I'm doing an interview with one of our dialysis patients, Miss Rebecca Lewis. Good morning, Miss Lewis.
Good morning.
How long have you been on dialysis?
13 years.
Wow, that's a long time. Can you tell me what surprised you most about being on dialysis and why?
Not being able to move the way I want to move, like going out of town or just the different changes, like with weight or being sick or the infection, having to get over that. It's just all different. It's different.
Were there any restrictions that you weren't expecting?
Well, my grandma, she was old when she was on dialysis, so she didn't really do anything. But yeah, because like when I had to come in here on Tuesday and Thursday, I'll be wanting to come on Saturday, but I can't because I want to work, and it had me tired. So that's the restriction right there, not being able to work the way I want to work. And go out of town when I want to go out of town.
Wow, that must be hard. So what changes have you had to make to fit dialysis into your life?
I work night shift now, so I can rest during the day. And I haven't been out of town in a minute, so.
What do you do if you have to travel out of town?
I miss, but I try not to go out of town too much unless it's on the weekend.
I hear you. So what things related to your dialysis has been the most difficult for you to adjust to?
The different foods I can't eat. We can't eat a lot of stuff on dialysis, so they kind of cut that out. That's a bummer. And you can't eat certain things. I don't drink anymore. Can't drink. You get sick.
It's hard.
Yeah.
So what do you wish that someone had told you about dialysis before you started it?
Take better care of my kidneys. Don't drink so many sodas. Watch what you eat. It's not bad. It's not bad. That's why I want people to think that it's bad. It's not bad. You still living. That's the number one. You still living. And it's only a couple of hours out your time to keep your life going.
What do you think that we could do better as nephrologists or the nurses to help patients adjust to dialysis?
Be a lot more open-minded. Because at the end of the day, if you're not sitting in that chair, then you'll never understand. You know, they be like, well, you're going to stay and get your treatment, but you don't understand how I'm feeling right now. It's a reason why I'm getting off the machine. I'm not getting off the machine because I want to get off the machine. Maybe I'm not feeling good, or, you never know what the case may be. Don't just, well, it's your life, or be nonchalant about it. Just be like, okay, it's your choice. Because it is our choice at the end of the day.
Yes, it is.
So they can be a little more open-minded about it.
Is there anything else that you would like nephrologists to know about being on dialysis?
No, I'm thankful for it. I ain't got no complaints. It's hard, but I'm grateful for it. Yeah, I'm grateful for it.
Thank you, Miss Lewis.
Thank you.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.